Ladies, if you are suffering with low back pain, what you may actually be suffering with is an SI joint dysfunction. So many women who come in to see me complaining of low back pain are actually suffering with pain in their SI joint, but they just didn't know that the whole thing existed, so they don't know how to describe that pain. Let me explain. Your low back is made up of the 5 lumbar vertebrae, and it sits about the level of your hip. So if you put your hands on your hip bones and your thumbs are pointed backwards towards each other, that's the area that includes the low back. A lot of women with low back pain will discuss a band type pain or a belt type pain right around the level of those hip bones. Now, this is different than an SI joint pain. SI joint pain is below that area, and many people describe it as a pain in their gluteals or pain in their butt. You see, the sacrum is a heart-shaped bone that sits at the base of the spine. The ilium, which are those hip bones that you put your hands on just a second ago, make up the sacroiliac joint, or SI joint. And a lot of women with changing bodies do struggle with SI joint problems. This can be pain, this can be a limitation of motion, and this can lead to a lot of other issues. This can lead to hip pain, it can lead to decreased strength, it can lead to numbness and tingling in your feet and your legs, urinary incontinence, abdominal weakness. It can eventually lead to low back pain and even travel all the way up your spine. Ladies, it is extremely important if you find yourself having that low back pain or that SI joint pain that you get help as soon as possible from a manual physical therapist. These joint issues don't often resolve on their own, and they can lead to really problematic issues in the future. You don't want to be in your 50s and needing a total joint replacement or peeing yourself because you don't have any pelvic floor control.